Brenda Kahler, Senior Manager here at Armanino, heading up our nonprofit client engagement team. Today, I am speaking with the partner who heads our social services sub-niche, Grant Lam, about trends he's seeing in the sector. So Grant, many of our social services clients have remained open throughout this whole pandemic, and many have seen an increase in demand for their services. How are they responding to this?
Hey Brenda, hope you're doing well. It's great to chat with you as always. And that's a good question, and a question that a lot of my social and human service nonprofit clients are faced with right now. A lot of nonprofits that and CFOs that I'm speaking with, especially those that are helping and providing services to low-income families, they're telling me that they're really just busier than ever. The demand for their services are at an all-time high, and they're responding by just working tremendously hard and getting the support of their staff and community to try and meet that demand. They're doing a lot of unique things. Many folks are having to think outside the box and having to get creative. The nonprofit community has always done a good job of teaming up and working together, and we're seeing that happen more now during the pandemic. We're seeing a lot of my clients that are teaming up with other organizations in order to leverage one another and maximize the impact that they can deliver to families and communities in need. One of my clients that has done this particularly well is Family Independence Initiative. They joined up with Stand Together, and they launched the Give Together Now campaign. So they came together and were able to really effectively work together and successfully, through the power of their network and technology, just connect thousands of low-income families to much-needed financial assistance. And this may not have been possible without the two organizations coming together. Also seen a lot of nonprofits having to pivot and change how they're delivering services, just given the remote work environment, not being able to deliver programs in a closed in a room environment. So I have a lot of clients that operate child care centers, and because of the SIP orders, they've been forced to shut down their centers. But that doesn't mean that they can't continue helping the families. So they've continued to their outreach to the families and continue providing assistance through other means, through financial help, through food deliveries, and just through counseling. They're having to get good, unique, and pivot the way that they're helping the families.
Those are really great examples, Grant. I imagine with the increased demand for services or pivoting and providing new services, that nonprofits must need additional funding to keep up with this. So how has the pandemic impacted their ability to get that funding?
That's exactly right, and that's another big issue that's facing this sector. And we're seeing a mix in terms of the impact on funding. Fortunately, the good thing is that for many social service orgs, the funding has remained steady, which has allowed them to continue running their programs. Government grants and contract revenue has continued coming in, and we're continuing to see a lot of help from foundations and individual and corporate donors. But this isn't always the case, and we've seen many nonprofits experience declines in their funding and really struggle to be able to meet that demand in their services. Nonprofits are always being asked to do more with less, and that's even more true now during the pandemic. It's been super challenging to meet that demand and not have the proper funding to do that. But overall, we all think the nonprofit community is doing absolute tremendous work, and we're all just very amazed at how the community has banded together in this time of crisis.
That's awesome. Thanks for all of these insights, Grant. I think it's going to be really great for folks to hear this. Thanks everyone for tuning in, and stay tuned for more nonprofit insights.